Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give the valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order and this is quite convenient for the study. I hope you will make use of it. My dear friends, since last class we have been started with a new series of talk. So that is related to bleeding and clotting disorders in children. Concept of and as well as approach to a child with the bleeding and clotting disorders. So in the last class we have seen the basics, how the platelet activation takes place, how the temporary and permanent plug, hemostatic plug will be formed. So that portion we have already seen. So today onwards we will come to the actual topic, that is concept of platelet disorders. So in the last class itself we have seen the clotting is basically involving two important parts. One is related to the platelets, another is related to the clotting factors. So when I say the blood is clotted, that means two things are involved here. One is the role of the platelets, another one is the role of the clotting factors. Now suppose if a person is having the normal platelet count, so we shall see the first condition, the person is having normal platelet count. Okay, question comes whether he has got any chance of bleeding. Yes, still he has got chance of bleeding, because if the clotting factors are defective, the plug, temporary plug which is formed will not be converted into a permanent hemostatic plug. So therefore still he has got the chance of bleeding. That means although the platelet counts are normal, okay, so which is very important for the formation of the temporary and permanent plug. If the clotting factors are defective or clotting factor problems are there, still there is every chance of bleeding. So bleeding is basically depends upon both the things, platelet and as well as bleeding, platelet and as well as clotting factor. So whenever the person is having bleeding as main issue, you have to look into the platelets and also you have to look into the clotting factors. Okay, now despite of normal platelet count, sometime the platelets may be malfunctioning. Now suppose another condition, now bleeding is there and you have seen the clotting factors and the bleeding factors, that is platelets. The clotting factors are normal, okay, the platelets are also normal count wise. When you see it is normal, but still there is a bleeding. I hope you got the point. Clotting factors are normal and the platelets are also normal, still the person is bleeding. Okay, now this is possible if there is any functional platelet disorders. So count wise platelet is normal, quantitatively platelet count is normal, but qualitatively platelet is not working up to the point. So that may also lead to the bleeding. So this is one more condition clinically where you are getting platelet count normal, clotting factors normal, still person is bleeding. Now you have to think about that. Although platelet count is normal, there may be some functional defect in the platelets which is responsible for this bleeding. Okay, so platelets will not to be going to function normally because of defect in either in the three steps that we have seen. ओके, अभी मैं जब बोलता हूँ प्लेटलेट का जो फंक्शन में प्रॉब्लम है, स्ट्रक्चर में कोई प्रॉब्लम नहीं है, काउंट में कोई प्रॉब्लम नहीं है, बट उसका फंक्शन वाइज वो फंक्शन अच्छे से नहीं कर रहा है, तो इसकी वजह से इन्वेस्टिगेशन में प्लेटलेट काउंट नॉर्मल आ गया, वो तो आएगा अगर स्ट्रक्चरली मतलब क्वांटिटेटिवली अगर वो नॉर्मल है तो रिपोर्ट तो यही दिखाएगा कि प्लेटलेट काउंट इज नॉर्मल, ठीक है, 5 लाख के आसपास, 4.5 to 5 लाख के आसपास है, बट किसी को नहीं पता ना कि उसका अंदर फंक्शन भी है, वो फंक्शनल प्रॉब्लम है. तो ये फंक्शनल प्रॉब्लम क्या है? व्हाट इज दिस फंक्शनल प्रॉब्लम? दैट इज व्हाट वी हैव डिस्कस्ड इन द लास्ट क्लास. प्लेटलेट एडिशन, प्लेटलेट एग्रीगेशन, प्लेटलेट एक्टिवेशन. Okay, these are actually three functions of the platelets. Okay, now if there is any problem in this function of the platelets, then also there will be bleeding, although report is showing normal platelet count and normal clotting factors. So further, person can still bleed although the platelets are quantitatively and qualitatively normal. So that is, if the coagulation factors are deficient, then it is no doubt it is a coagulation disorder, coagulation defect and coagulation disorders. Okay, but as far as the platelet is concerned, we have got two things. Platelets may be functionally defective, platelets may be structurally defective, quantitatively and qualitatively. Now, let us look into some of the functional platelet disorders. Okay, structure is normal, count is normal, platelet count in the investigation is normal, but still the bleeding is there. Clotting factor normal, still bleeding is going on. So definitely we have to think about it is the platelet disorder only, but functional disorder. Now, why the functional platelet disorders occur? That we will see. Despite of the normal platelet count, they cannot function normally. Okay, count is looking normal, giving normal count in the investigation, but still they are not functioning normally. What function is get affected? Number one is the first function of the platelet, that is platelet adhesion. If there is a disorder due to defect in the platelet adhesion, in the last class also we have seen platelet adhesion is related to GP1A receptor and also von Willebrand factor, isn't it? Now, if there is any problem related to this GP1A receptor and if there is any problem related to release of von Willebrand factor, platelet adhesion will not take place, and as a result platelet activation and aggregation not takes place. The permanent temporary plug is not properly, or the temporary plug which is formed, so that is not up to the mark and patient can still bleed. Okay, despite of normal clotting factors. Okay, so therefore functional disorders of the platelets may occur because of disorders due to defect in the platelet adhesion. Now, one of the common disease GP1A deficiency, suppose that receptor itself is absent, okay, due to some genetic problem, that particular receptor which will going to bind with the platelet, so that itself is absent, so that disease is called as a Bernard-Sollier disease. Bernard-Sollier disease, the problem will be there with a platelet adhesion. Because of the receptors are not get activated, therefore the platelet aggregation, platelet adhesion will not take place. Okay, so that may lead to a bleeding problem, and that problem is commonly called as a one of the most common problem is a Bernard-Sollier disease. Actually, what happens here is big size platelets will be there in the general blood picture. Okay, platelet maturation etc. will not take place properly, so platelet size will be more than the normal. Okay, so big size platelets will be seen. So this is one problem. Actually, this is a functional defect in the platelets, not the structural problem. Functional defects in the platelets. Von Willebrand factor, and we know that. What is the importance of the von Willebrand factor? Last class we have seen. Von Willebrand factor is very important for the platelet adhesion. So that is produced from the endothelium of the capillary. So that von Willebrand factor itself is responsible for bringing so many platelets together, making its adhesion to form the plug, temporary plug. But if that von Willebrand factor itself is not properly produced or partially produced or deficiently produced, then definitely the bleeding will be the clotting mechanism will be get affected, and this is because of the platelet adhesion problem. So platelet adhesion problem, functional problem, can be of two types. One most commonly GP1A deficiency and von Willebrand factor deficiency. Okay. Now, second, where the functional platelet problems occur is disorders due to defects in the platelet activation. Last class we have seen what do you mean by platelet activation. Okay, for the platelet activation, we need two factors. One is ADP and another one is thromboxane 2. Thromboxane 2. These two factors are important. But if these two factors are not properly produced, definitely there will be, although there is platelet adhesion, the platelet activation will not take place, and if the platelet activation is not taking place, then it leads to the problem of a bleeding. So when this commonly occurs, number one is taking certain drugs which inhibit these substances, thromboxane 2 inhibitor or ADP inhibitor. Such drugs if you are taking, definitely the platelet activation will not properly take place. Okay, one of the most common drug is aspirin and NSAIDs, other NSAIDs, which is cyclooxygenase pathway inhibitors. Okay, so they usually cause problem with the platelet activation, and as a result the platelet activation will not take place, plug is not properly formed, and a tendency towards the bleeding will going to increase. Okay, so another drug is clopidogrel. Clopidogrel will going to inhibit the ADP. Okay, what is ADP? We have seen in the last class. Okay, last video you can refer. So that will going to inhibit the ADPs. Therefore, the platelet activation will not take place, and as a result, the temporary plug will not be formed. Third functional platelet disorder is disorders due to defects in the platelet aggregation, the last step, aggregation, where more and more platelets come together, get together, form a plug, fibrinogen is formed, fibrinogen is converted into fibrin, water soluble, is converted into water insoluble. So like this, okay. So this involves many substances. This particular process involves many substances. We know that GP2B, GP2A, GP1A is related to the platelet adhesion, GP2B is related to the platelet aggregation. So this is the main thing which convert the fibrin into fibrinogen. Okay, function of fibrinogen is converted into fibrin. So that is GP2B receptor is very, very important. Okay, if there is any GP2B receptor problems are there, so then it leads to prolonged bleeding, and one of the most common disease which cause this problem where platelet aggregation is get affected because of GP2B receptor problem, that is called as a Klansman's disease. Okay, Klansman's disease. Absence of the fibrinogen or decrease in its concentration, so that is also possible in hypofibrogenemia. Hypofibrogenemia. That means genetically the genes which are responsible for the formation of the fibrinogen itself is not properly functioning. If it is mutant, then fibrinogen is not formed in a good amount. Then there is no question of conversion of the fibrinogen into fibrin. Okay, the whole process is get affected. So these are the two problems where disorders due to defect in the platelet aggregation. Okay, so platelet adhesion, activation, and aggregation, all the three are now function of the platelets. Okay, so if the functions of the platelets are get affected, these are the possibilities. Okay, on investigation, unless and until you ask for investigation requiring the structure of the platelets, the routine investigations, they only give the platelet count. In all these cases, platelet count will be normal, but problem is there in the functional. Okay, so these are the functional platelet disorders. Clotting factor is normal platelet count, but still person is bleeding, child is bleeding. Okay, so these are the three important things that you have to remember. Now therefore, whenever we talk of bleeding disorders, obviously there will be increase in the bleeding time, isn't it? Bleeding time will be increased. If you think physiologically, when there is a cut, after some time bleeding will going to stop, isn't it? Why this is happening? We know that this is due to the primary hemostatic plug formation, where the platelets will form the weak plug. And if the platelets are dysfunctional, dysfunctional, or if the platelet number is less, then bleeding may not stop in the normal time, and then it is called as increased bleeding time. But if the platelet functions are also normal, now just observe this sentence again. If the platelet functions are also normal, there is no functional problem as we have discussed so far, and there is only clotting factor abnormality is there. Okay, functional part of the platelet, structural part of the platelet, or quantitative and qualitative part of the platelet is absolutely normal, but still there is a bleeding. Okay, then you have to think about the clotting factors deficiency. Okay, so but if the platelet functions are normal and there is only clotting factor abnormality is there, then there may be normal bleeding time. Observe this sentence very carefully. Okay, bleeding time, bleeding will going to stop because of the functions of proper functioning of the platelets. What is the role of the clotting factors? Clotting factors will going to strengthen the plug which is formed. So when there is formation of the temporary weak plug, that time itself your bleeding will going to stop. That is a different issue. It may not be so strong enough, but bleeding will going to stop. So what I mean to say is, although there is a normal bleeding time, if the platelet functions are normal and there is only clotting factor abnormality is there, then there will be normal bleeding time. Bleeding time will be normal. So many times the clotting factors are left unnoticed. So what is the take home message? So in clotting disorders, bleeding time may be remain normal. So what I mean to say is, so therefore if the bleeding time is normal, it does not suggest that there is no platelet problem, there is no clotting problem. No. If the bleeding time is normal, one thing is very sure. What is that? Ensured is platelet problem is not there. But although the clotting problems are there, the bleeding time remains normal. Because clotting factors are not basically to prevent the bleeding, only to strengthen the plug which is formed. Okay, so we must go for clotting time. So bleeding time and clotting time both should be investigated whenever there is a child is having bleeding. Okay, if you are going for only bleeding time, so many times the clotting problems can be get missed. So it is routine to go for bleeding time and as well as clotting time. Now, how to differentiate between the bleeding time, that is how to differentiate the bleeding of the platelet deficiency and coagulation deficiency. Okay, so just by some of the symptoms you can understand that. So that portion we will cover in the next class, and thereafter we will take some of the cases also to make this very clear. So today, so we will finish here. So this much is sufficient. Functional platelet problem and some of the important things that we have to keep in mind. Okay, so if the bleeding time is normal, it does not always suggest that everything is fine. There may be some clotting factors deficiency may be there in spite of normal bleeding time. Okay, and if the platelet count is normal, it does not always suggest that there is no platelet problem at all. Although the count is normal, there may be functional platelet problems may be there which is responsible for the bleeding. Okay, so with this we conclude for today. Next class onwards we will continue the same. Thank you very much.